Hello and welcome to Let's Talk Climate, a new weekly webcast series from ecoAmerica. Featuring dynamic discussions with local and national leaders offering diverse perspectives, Let's Talk Climate brings forth the latest thinking and best practices for building public support and political resolve for equitable climate solutions in the U.S. I'm Bekkar, Director of the Climate for Health program at ecoAmerica, and I'm excited to welcome you here today for our first episode. Before we jump into our discussion, here are some brief housekeeping items. This session is being recorded and will be available on demand for viewing on ecoAmerica's YouTube channel. Please engage with us online using the hashtag Let's Talk Climate throughout our discussion and in the days to come. And please use the chat function to ask questions throughout the webcast. You can send your questions to us by choosing all panelists from the drop-down menu in the chat box. ecoAmerica staff are standing by to answer any tech questions and help facilitate Q&A with all of you, which we'll get to in just a bit. Today we'll be talking about motherhood in a changing climate, pregnancy and birth outcomes. Through our research at ecoAmerica, we know that majorities of Americans are worried about and experiencing climate change now. We've also found that moms in particular are even more worried about the future. More than 9 in 10 mothers say they feel morally responsible for creating a safe and healthy climate for ourselves and our children. Turns out, moms are rightfully worried about climate change. As our guest will talk about today, pregnant women and mothers are disproportionately personally impacted by our changing climate, and there are things we all can do to be part of the solution. Please join me in welcoming our guests. First, Nsedu Witherspoon. Hi, Nse.
Hi, glad to be here.
And Dr. Bruce Bekkar.
Morning, everybody. Thanks for joining us.
And Dr. Santosh Pandipati.
Hello, happy to be here. Excited for the conversation.
Thank you all so much for being here today and looking forward to chatting. Buckle up, here we go. For our first question, we want to dive straight into our topic for today, and also very specifically for the time we're in now. And we're actually going to ask a question that was shared as part of the registration process by one of our viewers. Dennis from North Carolina shared that he's thinking a lot about what nurturing new life looks like right now in this time of dual crises of a changing climate and COVID-19. And I was hoping that each of you could respond to that by way of introduction to our discussion. Nse, I'll invite you to respond first.
Thanks so much, Rebecca. It's really an honor to be here with all of you, and thank you for everyone's time. My best wishes to all of you and your loved ones during these very unprecedented times. This is, I think, a very important question for all of us to consider, and one that the Children's Environmental Health Network has been working on for sure. As a leader in the protection of children from the implications to climate change, and also a leader in the promotion of the overall well-being of children so that they are not vulnerable, and of course, mothers and parents nurturing those children. We have quickly had to pivot to the natural intersections that COVID-19 has brought into our world and into our field of work. As far as I'm concerned, climate change is the next COVID-19, unfortunately. It's very serious and a fatal pandemic that has further exposed a variety of injustices and problems within our public health, our healthcare, our farming, and our educational systems, just to name a few. And certainly these challenges have always been there. But one of the biggest lessons for all, I believe, is that if we do not heed the many calls for preparedness and actions related to climate change that are necessary, like we missed, in my humble opinion, in the early stages of COVID-19, we will most certainly find ourselves collectively in the most paramount of situations yet. So as far as nurturing children during both of these crisis events, I believe that acknowledging the mental health needs and well-beings for all families, but especially those most vulnerable, such as children, will continue to be a crucial priority. The social interactions that are impeded now during this crisis and will certainly be impeded with continued climate change implications are a factor. Current anxiety that we're seeing among folks, justifiably so, and anxiety concerns that will only surely come with increased climate implications. And I would include the realities of just being pregnant on its own. I'm the mother of 4. This is a very vulnerable time for a young woman and a couple. Anyone preparing for motherhood, and to not be able to be around your loved ones, to be able to touch them, hug them, kiss them, and at times even in the delivery room. I mean, how will things look even during climate implications into the future? Sadly, I feel we might see a lot more of that if we keep on with the same. The structure of attending school and childcare, outside of the home already is disrupted, as we have seen for the very first time at this level. Certainly with other extreme weather events, wildfires and whatnot, we will see that. We will see closings, we will see major obstructions. The changing paramount of a child's life is critical. And how will we fill those voids for them and the needs that they have to have social interactions with their peers? Also, the inability to get outside and do the type of physical activity that we would like to do. Playing at playgrounds, organized sports, playing in music groups one-on-one and with individuals. These are all very important social interaction components. And then finally, in these circumstances, I think when life is completely altered, like job, food security, housing insecurity, the needs will be so great, and as they currently are, that if we do not focus in on the well-being of the mental state of all of those in our society, especially those most vulnerable, the ripple effects will be just, if not more detrimental than the original implications.
Yep, Bruce, Santosh, jump right in.
I can jump in. First of all, Nse covered a whole lot of ground right there, and that was an amazing answer. And I look at it a little bit differently. I first want to echo your use of the word unprecedented. I think I've heard that word more times in the last 2 months than I've heard in my entire life. But the other word that springs to mind to me is it's not only been unprecedented, it's been unprecedented. We have had a time period where there's been such a tremendous and harmful lack of leadership at the federal level, where the degrading of science and the undervaluing of facts and preparation has had such tremendous ramifications that we really have to look at that as one of the areas that we need to address if we're going to move forward and nurture life into the future. We need to take advantage of this opportunity, as negative and scary as it's been, and really decide for ourselves as individuals, particularly people in healthcare now, what do we want to have going forward? Because unfortunately, COVID is not going to be the last crisis. Climate change is setting up a tremendous long chain of events that's going to happen, and each of them are going to threaten public health and threaten families. And there's no vulnerable group in my mind as an OBGYN, but I'm sure in many others too, that we need to protect more than the next generation, than babies and the mothers who carry them. So we really need to take advantage of this time and look to November as a time to change the leadership so that we can protect public health going forward, so that we build more preparation and anticipation into a system and more resilience into communities. So there's work to be done on leadership at all levels. And I think we as health professionals need to become more involved in that, as opposed to existing primarily, and in many cases, understandably, within the four walls of our institutions. We need to look at the bigger picture and make that part of our mission as well.
Yeah, to echo Nse and Bruce, first of all, thank you for the forum, and those covered a lot of ground. As a maternal-fetal medicine physician, I deal with high-risk pregnancies and pregnant mothers in precarious situations, whether it's because of their existing health conditions or something complicating their pregnancy. What COVID-19 has shown us is that everybody is vulnerable. It obviously affects the most vulnerable from a racial, socioeconomic, education standpoint, but at the end of the day, we're all one human species vulnerable to pathogens. It doesn't matter at the end of the day to the virus who the person is. Day in, day out, my job is to assess risk to that mother and that fetus, to provide counsel and guidance. The worry, of course, with something like COVID-19 is that it's just the appetizer for what's to come. And we have struggled as a healthcare system to handle COVID-19. My worry is we can wrap our heads around a specific pathogen like COVID-19, but when we have multiple areas of risk brought on by the climate crisis, it becomes overwhelming. And after a certain point, no matter what I or healthcare providers do on a one-on-one basis, if we fundamentally have an environment that is toxic to our health, we lose control of the narrative and we lose control of the outcome. And I think that's why I fully agree with you, Nse and Bruce, that this is the time for healthcare providers to become active in the political process, to start speaking up for patients. It's our ethical duty to protect their health and well-being. It's what we took an oath for, and that's why I'm participating in this conversation.
Thank you for those answers. I think already we've had a lot to think about, and I think already very early on you're calling us to action. No matter where we're tuning in, and no matter sort of Nse, one thing we talked about in prep for this call was you really framed action around things that people with very little time could do, and then people with a moderate amount of time could do, and then another level is people who are very engaged already. What they can be doing, and influential people, what more, can you be doing? And so very early on, appreciate the calls to action. I would encourage folks, our listeners, to check into climatehealthaction.org, where the call to action on climate health and equity is located. And you can sign on not only as an organization, if you're representing an organization, but now you can sign on as an individual as well. And so there's things we can do at all levels, and we'll be getting more action items throughout the conversation, but appreciate the call to action and really understanding that there's so much we can do right from the start of this conversation. One thing you also brought out in your answers already is talking about inequities, and some of the deep-seated inequities that are being revealed through COVID-19 are also seen in birth outcomes and maternal mortality rates in the US. According to the CDC, Black, American Indian, and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. And in the same way, vulnerabilities to climate impacts are in large part influenced by the social determinants of health. Can you comment on what you see as your recommendations to address these systemic inequities spanning health and climate? And Santosh, I'll invite you to answer first for this one.
Sure, thank you. As I mentioned, we are often in my specialty dealing with patients who have comorbidities. This can be chronic hypertension, pre-existing diabetes, obesity, and these are conditions that are not equally spread across the population. We know that there are patients who are more predisposed to these comorbidities. These are exactly the patients we are most worried about with COVID-19 infection, but not only with COVID-19, with exposure to particulate emissions, with exposure to ozone in the atmosphere, with exposure to high temperatures. When I'm addressing patients, I work in the South Bay area. We have patients who are airlifted in for various complications, and they come from areas of California that have been tremendously affected by particulate emissions, ozone, temperature, heat waves. It becomes very difficult, of course, to make recommendations such as be physically more active when, as Nse, you brought up, the fact that their environment may not be amenable to safe outdoor exercise. They may have no infrastructure in the community as far as public parks and safe bike lanes, et cetera, to use. We have to consider all of this. We also face socioeconomic and educational barriers. When we confront patients who don't have a strong background in health education and self-health education, it becomes very challenging to educate those patients. And often we're dealing with not just a patient in isolation, but we're dealing with her and her family. And so aligning the family to work together for better nutrition, better exercise, better lifestyle, and frankly, also better family planning to space out pregnancies so that there's time for the mother to recover, to have less pregnancy-related adverse outcomes such as premature birth, preeclampsia, fetal growth restriction. Of course, all of this dovetails with climate change. We know, in part, Bruce, with the work that you have been doing, we know that there are higher rates of preterm birth, growth restrictions, stillbirth, et cetera. Now we're starting to understand that there are higher rates of congenital heart defects with heat exposure, congenital cataracts. And so when we're talking about setting up our offspring for success, we are already at a disadvantage, and certain populations are at a greater disadvantage. So that's where I think we as physicians need to speak up to have, as Bruce, you said, science-based policies. We need evidence-based policies. We need a robust discussion about what are the best ways to reduce those inequities, Rebecca, that you're bringing up. At the end of the day, what COVID-19 has shown our patients is that we're all interconnected. The world is a small place in many ways, and what can start in China can spread easily to the rest of the world, and it can go the other way. It doesn't have to be unidirectional. So our behaviors matter now, our policies matter now, and I agree with Bruce, November is the key time. And I think the more we can educate the public about the need to support politicians who base policy based on scientific evidence and really are focused on the well-being of the population at large. Those are the people we should be voting into office and enacting the policies that we need.
Great. Nse or Bruce?
Sure, thank you. Very well put. You know, for far too long, communities of color and those of low wealth families in particular have been forced to be responsible for overcoming or simply dealing with the magnitude of abuse and injustices that they have been placed in by design. While resilient for sure, women and children, as we've been discussing, are certainly already vulnerable, and now we know pretty much everyone can be vulnerable to different aspects of concern and crisis. Especially related to health outcomes for a variety of reasons. So when you combine the various levels of injustice and inequity, only is, further magnifies one's vulnerability, as we've been discussing. And, I think it is important to just remind us all that we did not get here by accident. This is a systemic root issue of racism, divisiveness, bigotry that just needs to be acknowledged for what it is in order to be dealt with accordingly. Sadly, it's no surprise that those places that have been overlooked for so long, plagued by economic inequality, which is critical here, and environmental justice for decades, are also the ones that are already being worst impacted by COVID-19. It is completely unacceptable. I think we would all agree. And understanding that this is a huge weight to lift, there are steps that I do believe personally need to collectively, seriously, and exponentially move forward for a much healthier, just future for all, especially for the most vulnerable. Justice cannot be a secondary concern. It has to be our central response to climate change. COVID, one thing we can say is that COVID has opened everyone's eyes, right? There's not one person, I believe, almost on this planet at this point that cannot say, if not now, soon, that they have been impacted by COVID in some way. So now what will we do about it with these new acknowledgement that we are so interconnected and that our public health is all very much important and needs to be a priority for all of us. So I would offer unjust land use policies and practices must be stopped. They're still happening, unfortunately, frequently around the country. We need to be adjusting exposures. Adjusting exposures is one thing, but reducing or eliminating those exposures in the first place is a much more preventive action. We need to be thinking about regulations that are serious, right? So as was talked about, environmental, air, water, and food regulations have to be strengthened, not rolled back, and equally enforced so that all are protected from harm in every zip code. We cannot continue to knowingly sit back and allow for any population, especially the most vulnerable, to be exposed to pollution exposures and all the resulting health consequences. For example, I just spoke yesterday at EPA's hearing on the National Ambient Air Quality Standards, and that only addresses 6 major air pollutants, but yet many industrial developments are predominantly found in low-income communities emit more than those 6 pollutants, right? So you're not even accounting for the whole gamut of what a community, especially a unjustly overburdened community, is dealing with. So the co-benefits to fighting climate change are many, and the COVID-19 pandemic has already shown what good can come from reducing traffic flow, right? The air pollution, and even in Italy, you know, seeing the water pollutants reduce a bit just from such a short period of time. We need universal living income and minimum wage. The economic implications here are huge. In many of our states, half of one's income goes to paying for housing. So not to mention the expenses for childcare, food, clothing, shelter. Majority of the US population are not ready for a $1,000 emergency. So that does not leave much room for many to consider when you think about basic healthcare safety provisions on a good day, nonetheless a pandemic or a major response to a major extreme weather event or extreme heat event or any other crisis exacerbated by climate change. And finally, I would say economic investment. I've said economics a few times. It is obviously a root of all moving forward. We need to prioritize communities that have experienced historic disinvestment and across the range of needs. So as has been discussed, affordable housing, better infrastructure, safer, healthier, productive childcare and school environments, access to healthcare, and decent paying jobs and decent jobs that are not making people sick. We need strong, resilient communities who are prepared and properly resourced to withstand the impacts of climate change. We need big bottom-up change focused on and led by members of these communities that are most impacted.
I'm going to jump in because it's my turn, but I have to thank you both for what just felt like a masterclass in the answer to social inequities and how it relates to COVID and climate. But I want to specifically nod to Santosh when he talked about setting up future generations for success. On the one hand, we can talk about the problems that we're facing and the fact that COVID has only underlined and highlighted the vulnerabilities of populations that have traditionally been ignored and marginalized. And so now that this is clearly in everyone's mind, and I don't think we have to do an interview or conduct any surveys, everybody is woken up now to the idea that we're all connected, that we have this mutual interdependence that crosses all political and geographic boundaries. And in light of that, how can we continue, not even thinking about it from a moral standpoint, but just from a survival standpoint, how can we allow that state to worsen? If we are interconnected, how can we allow vast segments of our population in this country and worldwide to suffer the way that they are and to decline in terms of their health if we're all connected to one another? It literally doesn't make sense from a health standpoint, from an ethical standpoint, even from a survival standpoint. So this is really the time that we all need to step up and look beyond our traditional silos and just our thinking. And I think maybe hold up, as Santosh said, something to reach for, which is setting up future generations for success. And isn't it wonderful to see the dolphins have returned to the canals in Venice, and you can actually take a deep breath in many parts in China where before you really didn't want to do that if you were there. There are tremendous opportunities that we're being faced right now, and we're seeing the cost of our ignorance and our willful ignorance over the course of generations. So I am personally excited and inspired. I meet new leaders all the time, and say you and I met this morning. It's I'm blown away by how much I'm already learning from you, and I think we all need to look at what lessons we're learning and think about them in terms of what we want to create going forward. So.
And Bruce, I'm going to stick with you for just a minute to talk a little bit more specifically about. I know you're doing some work, some research on health, the pregnancy outcomes actually from climate change that we're seeing. Seeing impacts of pregnancy from climate change, and specifically on heat and air pollution. And so I was wondering if you could just talk a little bit about what you're seeing, what your research is showing. And then a little bit about your journey from being, so from practicing to more of a full-time advocacy role, and how you talk to others about this.
Oh boy.
Short, easy question, no worries.
As far as the research, first of all, I have to make a disclaimer, and that is that I'm not a researcher. I'm a clinician. I took care of patients for 29 years. But in 2015, the American Academy of Pediatrics came out with a position paper about climate's impacts on children. And that got a lot of publicity because, again, this subpopulation, children, gets people's attention. We all care about children. But in the OBGYN world, I think Santosh and I have bonded, and so many others are coming out right now to talk about this. There hasn't been as concerted a message. And so a few years ago, a group of us got together and thought there really ought to be more of a big picture look at the impact of climate on pregnancy in the US. A lot of what's been written about climate's worst impacts and their impacts on motherhood and on children have been written about third world countries and areas that don't have access to care. But there are a lot of third world cities and areas of cities within this country, and a lot of vulnerable populations, as we've been talking about. So what we've done is to pull together the studies from roughly the last 10 years in the US, looking at very common exposures, not the headline grabbing things like extreme weather events and rainstorms in Houston that drop 1 in 500 year amounts of rain, you know, every other year now. Or superstorms or huge fires, but more the ongoing daily impacts of climate that are rarely attributed. Things like warmer than average temperatures. And as Santosh pointed out earlier, air pollutants like ozone and fine particulate matter are very closely tied to the burning of fossil fuels and to climate change as well. So we looked at a number of studies, 68 of them actually, covering more than 30 million births all the way across this country. And we found very strong association, statistically significant connections between those exposures and premature birth, low birth weight, and stillbirth. And those are very significant outcomes. I mean, we don't need to talk about stillbirth. It's one of the most horrendous things that can happen to a family. It's beyond words. But premature birth and low birth weight are also very notable because not only do those children have a higher risk of dying in the first year of life, but they suffer problems, both psychological and physical, during their childhood. And we're even now finding data that suggests that they have a higher risk of major illnesses going forward through adult life. So those are very significant outcomes. And again, a very strong connection. More than 80% of the studies, and our review will be published in a major journal in the next 4 weeks, found strong association between heat and air pollutants tied to climate change and those really bad birth outcomes. So we're talking about the potential for generations being born in this country, and I think we're probably seeing the beginning of it already, where these kids are weakened from birth, and it's not the way that we want to allow that to happen by any stretch of the imagination. So it's a call to action. And we hope that pregnancy and childhood advocates, which I think includes everybody, are going to take notice of these findings. That's as much as I can say about that right now, but very briefly about my own transition. I got involved with climate. My eyes opened in 2007. I changed my life very significantly at that point because I love the ocean. And I love the idea of nature. I'm out in nature every single day whenever I can. And then I saw it as a clinician as well, that this is going to undermine, that the climate is allowed to continue to deteriorate, that our quality of life is going to go down steadily, as well as our duration of life. And neither of those is acceptable because it's all preventable. And there's so many good things that we can take from this. So I've gotten more involved locally and started driving a Prius and changed my life. And in 2013, I had the opportunity to semi-retire from Kaiser and go full-time with my advocacy. And we can talk about it if we have time, but I can just say it feels like an extension of the work that I've been doing. It's just on a larger perspective, but it's also been the best part of my career, I would have to say, is the chance to work with nonprofits and to give talks and to figure out how to write a scientific paper and to meet other inspiring leaders. I wouldn't trade what I'm doing now for anything.
And I was on a call right before this actually with a group of clinicians for planetary health and through the Planetary Health Alliance, which is another partner of Climate for Health. And it was, pointed out, somebody was talking about, oh, well, I'm not a clinician anymore. I don't see patients. And the response was, well, you do. You have one very, very large patient. And so I think I was just thinking about that as you were talking. And I think, it's so important, as we talked about in the beginning, to have health professional voices, discussing these issues, because we know health is a major motivator for action. So thanks so much for that. And then Santosh, I was going to ask you, can you talk a little bit about how you approach a conversation about climate change with your patients, your current patients, and also what kinds of questions do you get from them? And if I'm going to fold in a question that we got from the audience that also is about just how to talk about these. My question was really geared, I'm curious how you talk to patients. I think there's a lot of clinicians who are wondering how to talk to patients, how to fold it in. But then if you could extend that and talk a little bit about how you talk to others. I know you've had some speaking engagements, and how you talk to others about this as well.
Yeah, thank you, Rebecca. And Bruce, thanks for sharing your preliminary data. I know you can't get into more detail, but it certainly builds on a growing mountain of data. I think before I jump into that, I think I want to point out that we as healthcare providers have a very privileged status in society. We have a very intimate relationship with patients on a private one-on-one basis. It gives us a unique ability to communicate to fellow human beings. And I think we as healthcare providers are the one group of individuals that most of the public will deal with who are readily able to translate scientific information to practical day-to-day information. I mean, that is fundamentally what we do. We take data from medical studies, drug studies, et cetera, and we apply that for the particular situation. And it's time we start doing that with climate. And it's time that we start empowering our patients. And a lot of what I view this as is empowerment. When I'm helping a patient deal with a very difficult, complex medical problem, severe preeclampsia, fetal growth restriction, fetal anomalies, part of it isn't just dealing with that issue, it's providing the patient the empowerment and the ability, the knowledge to be able to make the best decisions she can for her baby and her family. And I think that is the same philosophy here. And I think we have to educate our patients. It doesn't have to be an overwhelming conversation. A lot of the conversations start pretty straightforward. Hey, you are mildly obese, you have a BMI of 30. What can we do to help lower your risk for gestational diabetes in this pregnancy? Let's talk about healthy lifestyles and exercise and diet. By the way, when you're looking at going out to work out and do a walk, make sure you're paying attention to the air quality index. Oh, why should I pay attention to the air quality? Well, the climate is warming. There are more pollutants. In California and the Bay Area, we've experienced wildfires and particulate emissions from wildfires from the droughts that have been ongoing. It's very easy to start folding these in. Light bulbs start to go off in patients' minds. And I start to tell them, these are behaviors that I would encourage you to do with your spouse, your significant others, your other children. You are going to no longer be a victim here. You can be somebody who can take charge of these situations. And then that opens people's minds and they start to say, okay, well, here are my barriers that I'm running into. Here are the barriers. One, I don't earn enough to afford the nutritious, healthy foods. Okay, so what can we do to work through those barriers? We have to start local and we have to start one-on-one. And as people start to understand, oh my goodness, I do have to pay attention to the heat index. I do have to pay attention to particulate and air quality. My goodness, who's doing something about that? Well, they know that we as the individual doctor can't do anything about that. But now we're educating the public in our own way. And now the public is empowered to think about these issues. And now when they go to the ballot box and they say, hey, who's out there who's going to advocate for my offspring, for my family? And I think this is where we have common ground, and this doesn't have to be very partisan or political. It simply has to be demanding accountability from our leaders. And I think the moment that we stop feeling victimized and we start feeling empowered, that's when we can make positive change in society. I'm not discounting the inequities. There are tremendous inequities across the board, and we have to deal with that for sure. But when we're dealing with an individual patient, how do I help that mother overcome the barriers that she's got? That has to be forefront in our conversations. Mm-hmm. And people are very open. They have been surprisingly open and surprisingly willing to engage in that conversation. A lot of this is, I think, also self-driven fear. A lot of healthcare providers don't know how to talk about this in a practical manner. And I think that's where we in Climate for Health, ecoAmerica, is doing a wonderful job to try and bring this information out. I saw in the chat comment line that there are still a lot of people who are not woke, unfortunately, to the topic. And I think, Bruce, you and I have talked about the difficulties we've had in the women's healthcare field. The American Academy of Pediatrics is really leading the charge on this. And I wish other specialties in healthcare, including the women's healthcare specialties, also recognize these climate change for the existential danger that it poses. And I think there's a way that we as healthcare providers in women's health can push our respective organizations forward to be advocates for our patients in this way.
Wow, thanks so much. I think that's a very interesting perspective, and I think has given a lot of people ways to approach conversations, because I think, you know, a lot of in our communications guidance, start with people is always the first thing, and I think meeting people where they are is such a key part of this conversation. Next to Nse, I just if you could share some of the tools, you know, from the Children's Environmental Health Network that you all are working on to help people take action and advocacy on climate. And somebody in the chat asked us about home environments and incorporating home environments into checkups and a health history. And I know you've done work on that. And so if you want to start there and build out to some other resources you're working on.
Sure, thank you so much. The Children's Environmental Health Network, almost 30 years here of work, has been I'd say a critical convener of key collaborations. I mean, we all know that we need these partnerships. We need this engagement with traditional and many non-traditional audiences to even get towards the collective action that we require in communities all over the country. And I would also say an effective translator we've been of the peer-reviewed science throughout the years in making what's available and all the important research that's being talked about in the needs meaningful at the community level. Okay, wonderful, these great research studies are being conducted. What does this mean for me in my home here, my childcare business, my small business, whatever that means, my kids' school? So related to home environments, definitely, I mean, obviously we look at where kids spend majority of their time, where people, but definitely kids spend a majority of their time, home environments. And especially during this COVID pandemic, we're extremely concerned about what the next 6, 12, 18 months will look like with kids spending time in places that are not healthy and safe and conducive on a regular day. I suspect we'll see, you know, higher rates of lots of things that are concerning that are happening in these environments, and unfortunately probably need to be prepared as much as possible to reacting and being a part of the social support experience for those children. But as far as home environments, they're critical. There are a variety of wonderful environmental assessment tools out there. We also have a training guide for healthcare professionals, in particular pediatric, but I know all kinds of healthcare professionals and community leaders use this tool. It's online, it's free, it's module by topic. And it also even gives a teaching tool, because we're trying to think of the next generation of leaders coming along. And it's, you know, how to take an environmental history as a provider, how to ask those key questions that my presenters here are talking about in the well child visit, right? So that any points of concern raised could hopefully be warded off before a child gets sick. We're trying to accomplish the same thing at the home level, right? Who are the people already going into some of these homes, so that you're not inundating families that are already overwhelmed, working many hours, coming in, and certainly in a very respectful way, culturally appropriate way, sitting down with them. It's about a trusted person who's coming in there, who's already maybe interacting with that family. Maybe it's the, you know, person coming in, the promotora or the nurse practitioner coming in to follow up on a well child visit or a hospital stay or an asthmatic episode, whatever the case may be. It may be a different fit for every community, but we're always trying to find, you know, who are some of those in some of our alliances, who are those people that are already trusted, that are already going into the home, that can also be a champion for proactive health measures in the environment where kids are spending a lot of their time, that are going to benefit the entire household. Also, we have the Eco-Healthy Childcare Program, which childcare facility, you know, we're training and educating childcare providers all over the country on safest, you know, low to no cost steps they can take to really make a change in their environments where kids are spending, you know, 8 to 10 hours a day, the average American child. So a lot of those are home environments. You know, there's centers, but there's also home environments. So you have the 1-2 opportunity here to not only impact the health and well-being of that residence, but also the health and well-being of a small business taking care of many children as well. Also, you know, we oversee what's called the Children's Environmental Health Movement. So we have a variety of tools for engagement. It's available on our website, cehn.org, and we're trying to assist on a variety of co-benefits of the climate mitigation and resilient type of efforts. So obviously, as we've been talking about, if we work to increase our health and well-being by reducing air pollutants, water pollutants, other major routes of exposures, those contaminants on our food supply as well, we will also see the wonderful benefits of helping to reduce the implications to climate change. We have Children's Environmental Health Day. It's always the second Thursday of October, which is Child Health Month. It's a day of action, right? It's one day out of 365, but we all could use some positive in our lives, right? On a regular basis, not to mention this fall in particular. What are we doing? What can we be doing and sharing for best practices of how we're lifting up children with them, with youth, learning from them and for them? And it's great. We track all those activities that are happening to help inspire and motivate others, and it's working. It's catching on. This will be the 5th year this year, and I hope that all of you get a chance to be empowered and inspired by checking out small things. It could be a meeting with the PTA and however the PTA looks in the fall, or it could be, you know, meeting with the mayor. It could be planning treat. It all counts, right? Anything positive here, promoting health and well-being and environmental stewardship. We also have a variety of toolkits for CEH Day, and we obtain proclamations. Well, we encourage constituents across the country, any of you out there who are interested in working with us, we already have a template of mayor and governor proclamations, a Children's Environmental Health Day proclamation. So many of them are signing on, but it's not just a photo op. It now is an opportunity, once they sign them and they're good for 12 months, to go and utilize them as an engagement tool with your elected leaders. This is wonderful, Mr. and Miss Mayor, Governor, you're doing wonderful on these accords. We applaud you on that. However, let's have a discussion about this in a proactive way, about how this is not upholding the proclamations that you just signed. Also, we are setting up for future generations the best we can. We mentor anywhere from 5 to 10 college and graduate students that come through our doors, and many of they're all working remotely with us right now, but we're very proud of the graduates of our what we call Children's Environmental Health champion internship programs that then go out and work for the government, work at city levels, work at public health departments, become practitioners, and have a huge understanding now of what it takes and why we should be so considering vulnerable populations of all kinds. We have state profiles, children's environmental health profiles that we have 3 already, and we have 3 more coming out in September or around Father's Day in June, and we hope to get into all 50 states. Again, these are engagement tools. You know, where do kids stand in each of these states compared to the nation? Looking at certain indicators, many of them are related to climate implications, and how can we do better if we're falling behind, and also lifting up positive steps that states are taking for kids. That's really important as well. And I'll finally just mention, there's a lot of things I could say, but we have policy statements regarding children on air and water issues. We work on a lot of collaborations, again, water in particular, Clean Water for All and Healthy Air Partners. But we also have a childhood cancer prevention report, the first of its kind, that's also been a collaborative effort coming out in the fall, hopefully September. It'll be the first time that the available science that's available and the gaps of understanding the trends related to childhood cancers and the connections to environmental exposures. Again, many of them are co-founding implications to climate. So I think that also will be a huge opportunity for us collectively to take a much stronger stand for children, as at times cancer prevention is labeled a behavior issue or related to what one has done with their lifestyle. Well, clearly young children do not have a lifestyle of drinking or obesity or other things that may be kind of thrown into that soup. So there are something like anywhere from 15 to 10% of childhood cancers are related to genetics. So there's a whole nother huge percentage that certainly are connected to environment, as we are increasingly learning.
Yeah.
So I will stop there, but those are just some of the tools that we would love to engage with all of you on, and happy to talk with you further about how we can partner on a lot of these important initiatives.
Yeah, and I think speaking from firsthand experience working on the state declarations, I think it's this very powerful tool to have state leaders really step up in that moment to sign the declaration and declare, Children's Environmental Health Day. But then it really provides a tool for advocates to then be able to put into action the tenets of Children's Environmental Health Day. So tremendous amount of work there to increase advocacy, accessible to anybody. It really is. Anybody can get involved. If your state doesn't have a Children's Environmental Health Day proclamation, you can download it and work on it. It's a great way to get engaged. And so I want to turn to our audience questions. We did get another kudos for the eco healthy childcare activities, and that folks are engaging with it, and it's a really helpful tool. So I want to make sure folks know the great work in action. So some questions are coming in about access to care, and talking about there's a specific question about abortion access, but I think in general, the question about access to care in a changing climate. What does it look like as people, engage in family planning, as Santosh mentioned, think about getting to the doctor, getting to the doctor's office, sometimes it's difficult, as we talked about, under normal circumstances. What if it's extremely hot, or you're expecting to give birth during hurricane season? What does it look like? What does it look like now to plan for a family, during a time of a changing climate? And maybe Santosh, I'll invite you first to jump in.
Sure. Yeah, thank you. What comes as a surprise when I talk to other healthcare providers, especially women's healthcare providers, is to say, a lot of what we do day in and day out actually has a huge impact on climate. Helping a mother avoid an unwanted pregnancy, even one unwanted pregnancy, has a huge downstream benefit to not only her family's well-being, to her health, but also to the environment. So allowing patients who want control over their reproductive lives, it goes towards the justice aspect, but it actually goes towards promoting their health. We know that if we were able to provide access to contraception worldwide to women who want it, who are asking for it, but don't have access, we could potentially eliminate 30% of projected emissions by 2100, 30%. And that's something that is well within the grasp of a healthcare provider, a family practitioner, general OBGYN, a nurse practitioner, providing that education and that access. We know that mothers who are better educated, if we can provide universal access to education worldwide, and we're not talking about college, we're talking about 12 years of education worldwide, that alone has been modeled to be more impactful than all of us switching to electric cars in terms of reducing birth number and, as a result, downstream emissions. We need to borrow language from COVID-19, we need to start talking about flattening the curve for emissions to buy us time so we can transition over to healthier economies, healthier ways of producing energy. Right now, we have a very limited amount of time. We have 8-10 years before we hit really irreversible and catastrophic changes that are kind of baked in. And the worry about waiting until we're staring at deaths in our face is that it'll be too late. So this is the time. because if we don't act now, that downstream impact is laid in. And so I think it's important to understand that access to care is something that healthcare providers are passionate about. And it's enlightening when I tell healthcare providers, by the way, that also helps fight the climate change and the climate crisis. And suddenly these connections start to go off, and it starts to say, hey, you know, me as a doctor, what am I going to do about, you know, big coal and big oil and et cetera? But the reality is you don't have to be directly doing anything about that. You can be empowering your patients to choose and have access to care that in essence will help address those issues.
And some of our other questions that are coming in are about collaboration. So how can healthcare providers, how can we work, or, you know, people in the public health sector, how can we work with our local health departments? How can we work with urban planners to address some of the things that we talked about earlier? And I know we're running up to the end of our time. So if we want to get into some rapid fire answers from our audience, we'll try to get one more in before we close out. So talk about collaboration.
I will chime in on that point. It was what I was thinking about when Santosh was talking about all the things that, all the policies that can be put in place in terms of patient care that have co-benefits. And that's one of the main things that I think has been such good news as I've gotten more involved with this climate problem that we have, is that everything that we do to stop or to flatten the curve, to keep us from the worst effects of climate change, has immediate health benefits for the community. So these are not unrelated, these are naturally connected. And I think it's something that healthcare providers, as part of the message that we can share when we talk outside of the healthcare world in addition, is that we need to stop the climate crisis. And oh, by the way, this is going to be a tremendous benefit to the health of people in this community. One of the organizations that I work with in town here is called the Climate Action Campaign. And there's been a big push that they've shepherded through the entire San Diego region to get us onto renewable energy and offer utilities through community choice energy. And it is a very consistent part of that messaging that health is going to be a major benefit, or the prevention of disease and suffering and hospitalizations and premature death is going to be a benefit of this big step we need to take to stop the climate crisis, and part of our responsibility regionally. So I want to reinforce that. And I also want to say that even if you're a busy clinician, and I was one for many, many years, there are plenty of things that you can do outside of your office that have the potential to make a difference. When I work with this nonprofit, many times I've gone to speak to city councils, and I've not had any training in talking to city councils, and I've written letters to the editor. And I think one message I really want to put out there is how welcomed I felt by councils, and how I got access to a number of publications with letters that I had written. You know, it's very surprising to me because I didn't have a background in doing this work, but there's a real appetite in the community and with elected officials to hear from health professionals, to hear from doctors and nurses.
Absolutely. Absolutely.
And it feels really good to be part of that conversation and to have an impact. Yeah.
Yeah, and I'll just say I do it now as you know, as part of Climate for Health and all of you, and I've done it previously as a local lobbyist. I was a lobbyist in the state of Maryland, and having the MPH behind my name and being a lobbyist was so rewarding. Going in and bringing the science to bear in the legislative process is just as you were saying, incredibly rewarding. Nse, did you want to talk about collaboration for just about a minute before we jump into our final question and sign off?
I just wanted to say Rebecca was a darn good lobbyist in Maryland too. We miss her. We still get her pro bono. But anyway, yeah, I just want to add that, you know, our health departments in particular, they need our help, right? There's so much incredible expertise, so much passion. They can only do what they can do. They need a lot more funding. They need a lot more trained staff. In order for that to happen, we need to continue to be the squeaky wheel to let our elected officials know. And again, if COVID is not an eye-opening experience for those that that have missed it up to this point, then I don't know that we're ever going to be there with some of them. But we have to constantly be advocating for our public health departments. They are a critical part of all of these collaborations. Can they do it all? No, but they have a critical part in any major form of public health dissemination and implementation. So I just want to put in a plug there. And whatever we can be doing to, of course, engage public health, but realize they only have so many people that can come to every table. So the more we can help them expand, the more we can get them, especially on climate related resilient matters. They want to do so much more, but they can only do what they're funded to do. They can only do what the number of trained staff that they have, but they're a critical part of our entire movement forward.
Great. Yeah, agreed. We're continuing to chat some responses into the chat box and some external links into the chat box for folks, because we didn't get to everybody's question, but we will explore other options to answer, perhaps through a blog series. We'll try to get to some of these questions, because it's really sparked some great conversation and questions from our audience. So last question to wrap us up, again, rapid fire answers. So hypothetical situation, you've been invited to co-author a new chapter in What to Expect When You're Expecting. It will focus on preparing for pregnancy, birth, and parenthood in a changing climate. What is your take-home message, your one-line take-home message for expectant parents, and what is a specific climate action any of us could take to support healthy birth outcomes in our communities? All right, so two lines. Ready, Bruce?
No pressure.
No, none.
Take home message for expectant parents: do all the things you were planning on doing, but now start to integrate what you're learning about climate into your thoughts too. And indoor air pollution is a crucial source. Your gas stove, if you can, think about switching it out to an induction cooktop. They're way better. It's a Tesla for the kitchen. And beyond that, think in terms of community as well. Your child will grow up in that environment. Get involved with your community and the choices that are being made locally.
Great. Nse.
Yeah, my tagline would be our leadership matters and impacts your health and well-being directly. So as we've discussed, and I don't think I've ever seen this in any What to Expecting book, vote, right? Look at who is being put on your slate for local elections and national elections, because it makes a difference. It's not the end all be all, but it makes a difference to critically make sure that we get folks that are proactive and understand and don't deny the science related to climate change, because that will help us tremendously in advancing. And as far as a takeaway, transportation, as we know, is a huge part of our air pollution issues. Air pollution can be very overwhelming to address and think about as an individual. Think about in your day-to-day, what changes can be made, how you get the kids to school, how your own kids get to school, how you go about conducting yourself. Again, in many communities, it's just not even a factor. It's not even a given. It's not very flexible, the options, but many of us can be doing much better. And I would also add, numbers matter, right? Align yourself with at least one advocate group out there that speaks to your passions, because there's so much work that has to be done. We do a lot of the legwork for you. Just submitting those letters, getting the numbers, increasing the amount of calls going in on certain issues makes a difference.
And Santosh?
Yes, thank you. Well, having a healthy pregnancy and a healthy family, it dovetails with having a healthy climate. And women, pregnant women especially, they don't have to be victims of climate change. They can actually become powerful advocates for combating the climate crisis. Choosing healthy lifestyles, whatever you can do to incorporate exercise, more plant-based diets, food diets, being methodical about accessing and utilizing contraception, space out pregnancies, avoid unwanted pregnancies. That surprisingly, those are the same behaviors that are incredibly potent for reducing greenhouse gas emissions and bending the curve on climate change. And I think that's what we can tell our patients.
Thank you so much, Nse, Bruce, and Santosh, for joining us as our guests today. Your work and wisdom truly is an inspiration to us all. And thanks especially to all of you who are tuning in today and for all that you're doing to act on climate. Please join us again next week on Thursday, May 28th for the next episode of Let's Talk Climate, Leadership on Climate Amidst COVID-19, featuring Bill Bekkar of the Presidential Climate Action Project, Jerry Taylor of the Niskanen Center, and hosted by our founder, Bob Perkowitz. Engage with us online with the hashtag Let's Talk Climate, and be sure to subscribe and follow us for the latest thought leadership, resources, and episodes on climate action and advocacy. From all of us at ecoAmerica, thank you. Please join me in caring for our climate in order to care for our health. Stay well, stay safe, and see you on the 28th.